Today we shall discuss about chemotherapy in carcinoma breast. So what are the settings where chemotherapy is employed in the management of breast cancer? Chemotherapy is used either in neoadjuvant setting or adjuvant setting or palliative setting. By neoadjuvant chemotherapy, we mean when chemotherapy is delivered before the definitive treatment, that is surgery. And this helps to make the surgery easier, and also it's possible to convert some of the cases to breast conservation surgery from mastectomy. And adjuvant chemotherapy is the one where chemotherapy is given after the definitive treatment, that is surgery. And palliative is given in advanced cases in stage 4 to palliate the symptoms. By neoadjuvant chemotherapy, we mean where chemotherapy is given before the definitive treatment, that is surgery, and it is usually done in locally advanced breast cancer when the tumor size is more than 5 cm, or if someone has lymph nodes which are large and matted in the axilla. And nowadays it is even done for lesser sized tumors and early stages where the patient has either triple negative, that is ER, PR, HER2 negative, or HER2 positive breast cancer. This helps in downsizing the tumor and downstaging the disease, and the tumor shrinks and the surgery becomes easier. And also it's possible to convert borderline cases to breast conservation surgery with this approach. And neoadjuvant chemotherapy is the real test for chemotherapy in any solid cancer, because we can monitor the response by seeing the tumor size and the nodal status. And patients who achieve complete pathological response to chemotherapy tend to do better in terms of survival. And adjuvant chemotherapy is the one where chemotherapy is given after the definitive treatment, that is surgery. And adjuvant chemotherapy is delivered based on patient's age, performance status, tumor size, nodal status, and the receptor status. Not all patients who undergo breast cancer surgery require chemotherapy. If a patient has a small tumor, node negative, and estrogen progesterone receptor strong positive, and HER2 negative, may not require chemotherapy. So it is individualized, and many factors are taken into consideration before we decide on chemotherapy for breast cancer patients. And palliative chemotherapy is the one where chemotherapy is given in stage 4 or advanced malignancy, where the aim is to palliate the symptoms, to prolong the survival and increase the quality of life. Very rarely patients with a single site of metastasis to bone may be considered with curative intent after chemotherapy if they have a very good response to treatment. Otherwise, by and large, it is palliative. So of course, chemotherapy has certain side effects. Most of the chemotherapy drugs employed in breast cancer cause hair loss. They can cause loss of taste or altered taste. Nausea, vomiting are one of the common side effects of chemotherapy. It can also cause body ache or fatigue. And fever and diarrhea are the most important side effects one should watch out for. All the side effects are reversible, and very rarely we see or encounter grade 3 or grade 4 side effects with the chemotherapy we do in breast cancer in the present time. And the supported drugs have made remarkable progress, and vomiting is almost controlled to the tune of 95 to 100%. To summarize, chemotherapy in breast cancer is used either in neoadjuvant, adjuvant or palliative setting, and the treatment is individualized, and risk-based treatment is followed in all the cases of breast cancer. Thank you. Today